Greetings, friends and followers. This is Nurses Talking. I am Del Bryce. As always, if you like what you see and hear, subscribe, leave us a comment. So today my guest is Dr. Catie Harris, PhD, MBA, RN. And Dr. Harris is the founder and CEO of Nursepreneurs, which is a global mastermind for nurses. She's an associate professor, and her goal is to empower nurses globally in business. Welcome, Dr. Harris.
Thank you so much. I'm so excited to be here.
I really appreciate you joining me today. So typically, my first question to nurses is usually, why are they nurses? So why are you a nurse?
That's a good question. I actually had a vision when I was like 16, and it was to go into nursing. And it's one of the few things in my life that I was absolutely positively sure about, never looked back. And it was just one of those things that I got this message, go into nursing, and I went into nursing. So that's why.
And so, typically I ask people, well, if you weren't a nurse, what would you have been? But I guess that doesn't work for you.
Well, I can tell you that my dad had other expectations for me, and he wanted me to be an actuarial scientist, and I never even knew what that was for years. And one day I looked it up, and I'm like, oh my God, that would have been awful. It's like, the insurance people that are always tapping out numbers to see what the statistical risk is. And I'm like,
and
oh my
benefits
God, that would have been horrible. So I guess if it weren't that, if I weren't in nursing, I'd be doing something in business, along the lines of where I've kind of evolved into anyway.
Yeah,
So
yeah. Yeah, so what kind of challenges were there though for you? Other than disappointing your dad.
Well, he got over it, so he's super proud now. But yeah, I mean the challenges of getting into nursing or in business in per se.
Nursing particularly.
Yeah, I mean, nursing school was, I didn't have the best study habits to begin with, and nursing school and college in general hit me kind of hard, especially because you're in there and you have your freedom and so I was a pretty average nurse, academically anyway, I'll say. And so my biggest challenge was trying to balance my freedom and my study.
Yeah, that's
Yeah,
a
so
huge
that
challenge
was
for
rough.
a lot of us, I guess. I guess it is. So once you graduated, what path did you take? What areas did you work in?
So I graduated and I went, it was 1996. And at that time, there was this huge surplus of nurses that had just graduated, so much so that there were no jobs. And I'm in a big metropolitan area, Philadelphia. So none of the hospitals anywhere around, assisted living, nursing homes, nothing. You could not get a job. I couldn't even get a job as a nursing assistant. So I every day it was like sending out resumes. And finally I was like, I'm going to broaden this search. And I went across the US and started sending resumes to like South Texas, New Mexico, wherever I could. And they contacted me pretty quickly. So I ended up taking a job in this little tiny town of Victoria, Texas, South Texas. There were like 30,000 people there. It was like coming from Philadelphia. I mean, it was culture shock. But I went down there for I spent a couple of years down there, so it was a really good experience.
It's interesting to hear you refer to, going from large to small as a culture shock. I can totally identify, because I grew up on a little island where the max at any given time, the maximum population was about 15,000. And then I went off to England to become a nurse. And so, I get your culture shock.
You had the reverse culture shock.
Absolutely, absolutely. And so now you tell me that the person you describe as an average nurse academically is now a professor.
That's a good question, because I had a GPA of like 2.9, and that was because my first 2 years I really struggled with that balance. And then I was like, you have got to get it together. And I did really well my junior and senior year. But yeah, I mean, that kind of stuff can really harm you
Yeah.
in later years. But I went back for my master's in business first,
Hmm.
and I had to take some prereq courses. And at the time, I was just really excited to be back in school. So, I mean, I got all A's in all my business courses, so that, showing that I had the potential to do the work. And now that I was more mature when I was going back for my master's, helped a lot. So then when I applied for my master's in nursing, even though my grades were lower as a BSN, I had an
Yeah.
MBA already. So
Yeah.
yeah, it was just a learn to love learning later, a little bit later in life. So
It's just a curve. It's just a curve.
yeah, I always think about that when, because we admit students and, sometimes I'll see students that have a 2.9, but they write a really great essay and
Yeah.
the passion that they have comes through. And I'm like, yep, that person's okay. I'm like, I see myself in that person, you know.
I get it. I get it. So, what is now, as you look at it, what is the biggest reason you see people coming into nursing?
Come So I think there's a lot of appeal to nursing. There's For me, it was always kind of people that want to help people. It's a secure job.
Hmm.
I think. And especially because I've done some corporate work as well, and that was brutal. The constant fear of being hacked or not
Hmm.
hacked, but like cut
Yeah.
out and that
Yeah.
kind of stuff. Yeah. So there's a lot more stability. And it's just I think it's a nice profession. You can feel good about yourself and get paid a decent salary and help others. And I think I don't know, that's really compelling.
Yeah. All of those. Yeah. All of those things together. Um. Yeah. Are appealing, I guess. What kind of changes would you like to see, though, if any, in the nursing as a professor? What kind of changes, if any, would you like to see in the education of nurses?
Oh my goodness. Yeah, I mean, I'd really like to see. Um, I think we have a very narrow ideal of what the nurses should be doing. There's this kind of expectation that nurses graduate and go straight to med surg
That's it.
bedside. Yeah, and I think it's a really narrow view, and I don't think it's reflecting what's about to happen. And I think COVID's really thrust us into this new period where people don't want to spend time in the hospitals. They don't want, and the hospitals can't really afford to keep them there. So the outpatient setting is so vital, and we don't really have the infrastructure, or I don't think the nursing students are being taught to manage in the outpatient setting as much as they need to be, because
Yeah.
we're definitely heading that way.
Yeah. 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 We need to learn to be a little more autonomous, I think.
Yeah.
Yeah. Yeah. And so now you have created a business. You're a nursepreneur. You have it says that his nursepreneur is a business by nurses for nurses, and you want to globally, bring nurses into the business world. Why?
One of the reasons that I wanted to do it was because as a nurse at the bedside, I felt constrained. And like I said, one of the things that I love to do is learn new things and, just follow ideas and see where they take you. And in the hospital system, that really wasn't appreciated.
That's hard to
I'm
do.
gonna say,
Hmm.
yeah.
Hmm. Yeah.
They kind of want you just to do what they hired you to do, which is fine. It's just not the type of person that I am. So I recognize that, most nurses probably don't want to be an entrepreneur, but I think it's an outlet of expression for those who want to solve problems, who want to I see entrepreneurship as a leadership role, because you have to step into you're saying I have a solution to something, and stepping into that role takes a ton of courage. And I think it's a great place for nurses, because we know nurses have the solution. And anytime you have a problem, the first thing you do is find out what the nurses are doing, or put the nurses on the case, because they can
Yeah.
work with a shoestring budget with nothing and create something amazing.
So you didn't use the word, but as I talk to nurses, that idea comes up a lot. This idea of nurses being very innovative and being able to bring things together very quickly and very efficiently. So I was going to ask you what special qualities we bring to the business world, but I think you just said it.
Yeah, it's huge. And I mean, we see it all the time, like in high level meetings and stuff. And they're like, well, we got to solve this problem. And the first answer out of anybody's mouth is, well, the nurses can do this, the nurses can do that.
Yeah.
But the nurses come up with some amazing ideas. And, we've done hackathons, not Nursepreneurs, but San Seal has done hackathons, and I've been to them. And the ideas that they come up with are just like mind blowing. You're like, oh my God, yeah, that sounds awesome. Like, I love those things. They're so exciting.
That's great. So what would you say then you seem to have done so much. What would you say is your greatest achievement so far?
From a personal standpoint, I would say it's really about stepping into the role of being a leader and accepting it, because that was my biggest challenge. Because there's always that kind of like, well, I need to report to somebody, I need to ask somebody's permission, I need to do this, and it's kind of like, well, no, because I'm pioneering this role, so you have to step into that. And it's it's scary. It's like there's something about having somebody over you that's somewhat comforting, even if you disagree with them. Yeah. But when there's nobody there and it's just, you're kind of there by yourself. Right. And then you have to start questioning things. Well, am I doing this right? Am I leading everybody in the right direction? Are we about to go off the cliff? Like, where are we going? So it's a completely different mindset.
Yeah, I get that, and I understand that because after I became a nurse, and I became a midwife in England, and then I went back to the Caribbean for a couple of years, and found myself, it's a slightly different situation, and found that I had to do a lot more thinking and depending on myself to get things done. So I get that that feeling of, oh my goodness. So yeah, it's really but it makes you grow.
Yeah.
It makes you grow. So it's a good thing. So you have this business and you want to influence nurses globally. And when I think of it, it keeps going out and out and out. How big do you want to see this get?
So, I like connecting with other nurses. And years ago, I went in it was an International Council of Nurses retreat, and it was called Global Nurses Leaders Institute. And that is really what kind of opened my eyes, because I met so many nurses from around the world that were doing fascinating things. And to me, it's less about global as it is different situations, and learning about, oh, this is how they do nursing in Kenya. I have a nurse that's there, and in Australia, and in Singapore, and all these different places. So to me, it's fascinating and exciting. So it's less about the global aspect of it. It's more just the reality of it, because there's different cultures of nursing are expressed in different ways. And we all have still that common thread and that common bond amongst ourselves. So we're all nurses, just we're doing nursing in different ways. So to me, that's exciting.
I couldn't have expressed it better myself, because that is one of the core things of this channel, is that I want to talk to nurses everywhere for that very reason. So that's awesome that you're doing it that way. You're doing it that way. I'm doing it this way. That's really, really great. So what words of, if someone wanted to become a nurse today, well, yes, they do. And you're a professor, so you see them. What words of inspiration?
So if they wanted to become a what?
A nurse.
Someone a nurse.
Wanting to be a nurse today.
Oh yeah, I always encourage people to go into nursing. It's such a versatile career. I mean, to me, when somebody says to me, what well, what can a nurse do? And I'm kind of thinking, well, what can a
What
nurse do?
cannot?
Yeah.
Everything.
Yeah. You compare it with anything. And the thing that I had trouble with is after I got my nursing degree, it was almost kind of like, all right, well, now what do I want to be? Because I
Yeah.
can work in the hospital, I can work outpatient, I can work corporate, I can, I could go work in NASA. They have nurses in
Yeah.
NASA. You can work in the
Yeah.
school, like anywhere.
At
One
the
of the things that
airport,
at the
anywhere.
airport, yeah, one of the things that I really wanted to do was I got my family nurse practitioner because I had I don't know why I did this, because at the time I was a single mom. Well, I'm still a single mom, but my son was like just born, and I'm like, yeah, I
Mhm.
should get my family nurse practitioner, and then I can work in the embassies around the world. And completely unrealistic with a newborn baby by myself, but I did it. But that's another option. There's just, it's so exciting.
Yeah, the options really are never ending. And when I when I think of the options in nursing, I remember a story. Many years ago, I worked with a Russian lady who told me the story of when she first came to the United States. And she went into the supermarket to buy bread. And there were so many choices of bread that she cried and went home because she didn't know what to do. And sometimes I feel that way about nursing because there's so many options and so many, avenues that you could explore. You feel like I won't live long enough to explore all of this.
Right. That's why I think we almost have to kind of redefine burnout, because it's
Yeah.
not nursing that's burning you out. It might be, the kind of
Mm-hmm.
the conveyor belt of medicine, of working at the bedside, that's burning you out, but
Mm-hmm.
it's not nursing, because there's so many things that you could do aside from working in the hospital.
Yeah, indeed, indeed, indeed. And as you bring up burnout, and we talk about it a lot, a
Mhm.
lot, a lot, a lot. Um, what do you think that we can do to recognize that this is happening and to prevent or to cope with it?
Yeah, I mean, a lot of the solutions that I have seen are kind of geared towards, I don't know, the nurse meditating or the nurse fixing herself or himself, but I think it's a systemic problem.
Huh?
And yeah, I mean, that comes from the top down, and I think it
Yeah,
has to do with, you know, despite nursing being the largest health profession in the hospital system,
anywhere.
we seem to have the least amount of power or say or influence in what happens. So things happen to us, and when things happen to you, you don't feel like you can be an instrument of change. And I think that has a heavy burden on the profession. So I would really like to see, one, I'd like to collectively come up with a solution, such as what would make the hospital a great place to work. What would that look like, as opposed to, what
Ah,
is today,
mm-hmm.
um, so that we don't have burnout. Because you have other professions like firefighters. I mean, that's a really, really intense job,
Yeah, yeah,
but they don't burn out the same way
the
that
way we do.
nurses burn out. Yeah.
Mm-hmm, 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 mm-hmm.
I think it's a control factor.
Yeah, yeah, yeah. I'm hoping that as nurses become step into higher and higher levels of education and management and stuff like that, that kind of thing may change. That since we get to, if we put ourselves in positions to affect the policy and affect how things are run, and because very often now the institutions in which we work are run by business people whose mindset is different. Not that their mindset is wrong, it's just different than ours, and the decisions that they make from a different mindset affect us very deeply. And I hope that we can, be involved a little more in the
Right.
decision-making process.
Exactly. And I guess that's where the entrepreneurialism comes in as well,
Yeah.
because like I said, I think the burnout can be alleviated with some aspect of control. And when you start a business, you take complete control. So it's a 180 that you're doing, and not everybody likes that. Maybe they want a little control, but not complete control. But
Mhm, mhm. At some point, you want to have someone else to blame.
yeah, that's always nice.
So, I have a question. if you had to describe one intrinsic and very important essential quality of a nurse in one word, what would that word be?
Uh, I would say empathy would be the biggest word that I would use. And I think nurses have it. I think it gets driven out of us in a lot of times when we're so busy, or we're have to work with a chart, or we have to run people 20 different directions and that kind of stuff. But not just empathy for the patients, but empathy for your peers, empathy for the doctors that are also burnt out, and the C-suite who's under pressure, and just understanding that we're all kind of in the same system, and we're all have our burdens in different ways.
Yeah. I'm glad you mentioned the other members of the team, because that when you said empathy, I was going to ask you about that, because when we think of it, often we think of being empathetic to the person that we're taking care of, but we forget that we are part of a team, and that empathy needs to be. I tell people, at one point I was an adjunct, and I used to tell students that if I mentioned coming from the Caribbean, and in Montserrat, where I'm from, saying hello is as natural as breathing. So if I come in, I used to say, if I come in one day and you say hello to me, and I ask you, you tell me good morning, and I ask you what's so good about the morning, that's the day that you really need to pick up the slack for me, because that is not who I am. That is not who I grew up to be around, and we need to recognize, though, that the whole point of telling people that was that we need to recognize that every day is not everyone's best day. And sometimes we need to pick up the slack for our team member and not murmur about it. Just do it.
Yeah, absolutely.
Yeah. Is there anything else you'd like to share with us today, Catie?
No, just I love nursing. It's something that I love to see nurses stay at the bedside. It pains me to see some of these nurses that have been in nursing for 20, 30 years leave the profession because of burnout. And I just want to say that there are other options out there. If you want to do entrepreneurialism, definitely come and check us out. But aside from that, there are a million other things where nursing expertise can be leveraged and just honestly make the world a better place. And that sounds kind of cliche, but I really believe in that.
Yeah. All you really have to do is just open your mind.
Yeah.
And it's all there. It's all there. Thank you so very, very much for talking to me today. I really appreciate every single minute of it. Thank you.
Absolutely. Thank you.